The last video we left off with your continued attempts at stock market speculation.
Yes, that was fun. Yeah.
That went on for several months, but you never again had a success like you had in 1987, did you?
That's correct. Okay. That was correct.
And
a lot of luck.
And through all of that, and through all of the months that you were speculating, you continued with your study in volitional science?
Yes.
Right?
Yeah.
And as well as continuing your weekly meetings with Bill Martin's group, right?
That is correct. Yes. Yeah.
And I imagine you were also continuing your personal studies in history and science and wherever that led you. Yeah.
That's correct. At that time, I think I was reading laissez-faire economics, von Mises and that sort of thing. So, yeah.
Okay. Then, in about 1989, Matt Mazer, who we mentioned is one of the 6M partners, approached you with an interesting opportunity.
Yes.
Tell us about that.
All right. Well, he had graduated from Brown University, and he had gotten a job in a small, what they called boutique investment firm up in Los Angeles. And so he was looking at different investment projects for the company, and he would do the analysis and write up reports, and then they would go to the investment group and they would analyze it and make decisions on different projects, and they would then put money in or decide not to. During that time, he came across a little group down in Texas that had a safety syringe that would allow the doctors and the nurses, principally the nurses and the primary caregivers, to be able to give shots and protect them from the needle after the shot had been given. And so he heard about this, and he went down to Texas and met with them. And he was very, very intrigued. And all they had was some concepts drawn up on some, drawing boards and that sort of thing, computer-generated stuff. Back then, that wasn't a lot. I mean, the computers weren't quite as good as they are today at a personal level or at a small group level. So but he thought it was a wonderful idea, and he realized that there was a big market to it. So he started to chase it down, and he took some of his money and locked in the deal. And then he was looking for some help, and he came back and talked to me about the project. And he knew I was wanting to find some big projects to help get off the ground because I had big plans once I got some money. So that's how it all began.
He knew about all that?
He hadn't gone in and listened to V50. By this point, I think I had mentioned my sister had passed, the one that he was seeing from an unfortunate skiing accident. And but he stayed close with the family. And of my family, only the one that unfortunately passed had gone to V50 and listened to parts of V50 with me. The rest of the family, they were following their different courses in life. So he knew about it principally because my sister was had listened to it and had talked to him about it. And I had talked to him a little bit about it as well. So he knew I was into something that would involve requiring some serious capital in order to start these projects. So he had some understanding, but not a deep theoretical appreciation for the subject. So, yeah.
Okay. So he, I guess what was my question? Did he know about your goals? So
yes,
he sort of did, and that's why he came to you. But so go ahead and continue with what happened after that.
Okay. So he was in Texas for a while and was looking for money to get the project going. And he was also beginning to look for people with technical expertise to help him. These parts are made in what is called injection molding technologies. And so he started looking into the injection molding processes and start to study how existing syringes were manufactured. And this was before BD even came up with their safety syringe, and also Sherwood.
Who's that? No.
All right, BD and Sherwood are the two large syringe manufacturers in the United States, but they're not just the United States. They're one of the three larger producers of your standard syringes. They make billions and billions of these each year. And they use injection molding to make the parts, and then they use machinery to put it together. So he started to look into the technology, looked into what size of the market was and that sort of thing. And so he was down in Texas for a while. And then because he had gone to Brown, he had a number of friends that were in New York City. And he also had a few contacts from when he was in Los Angeles. So he went to New York City, and he was there for a month or so before I got another call. And he says, Ben, I've got a friend, and we've got a place where you can stay, so you don't have to worry about hotels or anything like that. And so on the spur of the moment, and I had yet to lock into anything, and this was looking very, very promising at the time, I said, okay. And so I jumped on a plane and flew to New York City, and it was the first time I had ever been to New York City. And when you drive into that city for the first time, and growing up in San Diego, you had some modestly tall buildings in San Diego, but it's nothing like driving into Manhattan for the first time. And so
that was awesome.
Yeah, it was. And so I was there for several weeks, and during that time I helped him compose the business plan. He had the contents, but he needed help on typesetting and getting the formats correct and all that. And I was much more conversant in computers, and so I took what he had done and formed it up into a better presentation and that sort of thing. The content was, he had done a very good job on the content, but I finalized it and used all the tricks or some of the tricks that are in typesetting programs and that sort of thing. And so we produced a presentation, and then we proceeded to go from investment firm to investment firm throughout Manhattan. And so I got a rush opportunity to see what Manhattan was like and all the rest of it. And so it was quite an adventure, to say the least. But as we went through it, it was too early in the stage for them to be interested. And they saw too many risks. And so finally, after a couple of weeks, I came back, and then Matt chased a few more things down, and then he met someone, of all places, who was in New York, that was from San Diego, and this lady was the first one to provide financing beyond what Matt and I were putting in as a result of the 6M partnership. So that's how I started into the process.
Okay.
Okay.
Well, just continue with the story. I don't know, what came next? Did you go back home and?
Yes, and then Matt came, and for some months he was working alone. I was talking with him on a fairly regular basis, but finally he got to the point where he met some people. He got enough money, and he started to look for plastics engineers. And he finally settled on a gentleman by the name of Carlos Manjares. And at the time, he was a young man in his mid-20s. He just started his family, a small. That becomes more important later on, but he got involved with it, and he was working at an injection molding house, and it was also a design house for helping design plastic parts and that sort of thing. And Matt had gone to a number of these places, but talked to a number of these different plastics engineers, and he finally settled onto this fellow. And this fellow turned out to probably be at the time, one of the most brilliant plastics engineers. And so for the next several years, we were working on how do we make this product? How does this product get put together? And then once we have it, what is it going to take to mass produce this. And I was helping, especially once he started to get product coming out of the injection molding. He paid for some low-cost molds and started making proofs of concept. And the interesting thing about doing plastic parts is that the plastic parts themselves are really dirt cheap. But every change that you made to the mold costs like $4,000. So, when you design something and okay, this looks like it will work, and you then go get the shop to manufacture it, and you're writing another check for $4,000. Then they put it into the injection molding machine, produce the parts, you look at it, see where it works, where it doesn't work, and so forth and so on.
Are the molds made of metal?
Yes.
What kind of metal do they use?
On the low volume molds, they're made out of aluminum. But the high quality, the really precise molds are made out of high quality stainless steel stainless steel. The problem is that in the product that we were designing, we were finding that the tolerances you had in normal machining, you hold tolerances to a couple thousand. So you have 1,000ths or 2,000ths of an inch in your metal parts. But to make this syringe work, we had to hold tolerances in plastic to what you normally hold in metal. We had to be within 1 or 2 thousandths to make it work. So that meant that we had to hold the tolerances of 2/10, 1/10 of it, or 4/10 of a thousandth of an inch. So we had to be much higher precision in order the product to work. And so that always made it very, very much more expensive to make the part. And so we went through the cycle for a number of years and continued to do it. And at one point we had a semi-reasonable product. It wasn't anywhere close. And what was funny is that Matt was talking to everybody. And we were getting patents on all of this, and going through the patent process. And that in and of itself is not a cheap process. So he was introduced to a Korean company, and he showed him the product, and the Koreans ran off with the product and basically stole the idea.
What?
Yeah. But what was interesting is we calculated they must have spent $500,000 to get the first first products. But then they came into the marketplace, and they even stole kind of the same name. They kind of changed it. So
the Koreans have this syringe?
No. They had the earlier version that leaked.
Oh.
Okay. So they built it, and they thought, oh yeah, and then they ran through the process. And then when they finally got done, they had a product they couldn't sell. And it took us another year or so after that to perfect it. And during all this time, we kept getting more as each step in the development process occurred. The product began to sell itself more and more, instead of having to talk about the advantages to it and wave your hands. And in fact, I've got a sample here that goes from ancient days. It goes back to the days.
Fun. So we'll be able to have you demonstrate that in a little bit.
Yes, we'll do that in just a moment. Where was I?
That brought to mind a question. So you're doing all this work. Are you like in your garage working, or what's going on with the?
Well, we were kind of business? Working in our apartment. Matt had an apartment down, sitting up on the hill overlooking San Diego Airport, and he had a 2-bedroom apartment, so I came and started crashing there, and working with him, and so we were doing all of this. Before we got our first little place, and I'll explain that in a moment. Okay. And so he would go out, and we would contract with mold injectors. We would go to mold makers, and they would make the molds, and then we would ship it over to a mold. Once we got really close to having the product work, then we would send it to the injection molding companies that would inject the plastic and make the parts, because it takes big machines to make these plastic parts. And then we would get them. And in the early stages, we were assembling it on our kitchen table. But what we would do is you had to make it in a clean room. So what we did was we got tape, and we taped the whole room up, and we draped the plastic over the doors and that sort of thing. And then we would wipe the whole place down with rubbing alcohol and getting in it. And then we would sit at a table. And by this time, Matt had a girlfriend, and she was helping, and I would be there, and there was another friend of Matt's. And we would all sit in the table, and we would assemble it. And in fact, there was one time, and well, before I go in, I'll show it to you.
Okay, you're gonna have to hold it up. So
yeah.
The
and so this one was actually one. This wasn't a final version. He made it even better than this, but this has been sterilized. So this.
Okay, hold it up because we can't see.
Can you see it now?
Yeah. There we go.
All right. So what happened was is we got these. They're not the same ones that you normally find. These are self-sealing. We could seal them and put the syringe in. And this is one of them that we hand assembled. And so, and we got the needle in it, and we were buying the needles from, and we were because you had to be expert on the needles, and who supplied the needles and the best needles, because you don't want a syringe that has imperfect, lesser quality needle, because then everybody would associate it with your needles. So we learned a whole lot about just these needles and the cuts on the needles and how all those are things. I mean, I can sit here and talk for hours just about all the different technology. So we packaged these and packaged it on our kitchen table in a vacuum.
That there was packaged at the kitchen table?
Yeah, it was packaged at the kitchen table. And then what we did was...
This is how many years ago? We're talking 1988?
No, this is my 90...
Oh, right, because it went on for years.
Yeah,
okay.
this is 93 or 94.
Oh, okay. So,
okay.
Oh my gosh, that's 24, 5, 6 years old.
Yes. And and so what we did was we would package it, but it needed to be sterilized.
Okay.
And there was a place up in southern Los Angeles area. It's just north of the nuclear power plants. Do you remember the area just north of the three nuclear power plants were right on the coast of California?
San Onofre?
It was north of San Onofre. Because
I don't remember.
And I think it was one of the streets is up there off the freeway.
Can you hold that so that we can see like the whole? How do we get that in focus? Hold it back by your face.
Can you see it?
I think so. So if we zoomed into that, be able to see it. I think.
Yeah, and so that's the problem.
Okay.
So what was funny is that we would assemble these things, and we would drive up, and there was a sterilization place that was using nuclear it was a cobalt-60 sterilization. And
was that coming from the nuclear plant?
No, well, I'm not sure where they got the cobalt, but it could have been coming. But what they did was that they built this way back before all the houses grew up around it. But it's a nuclear facility with cobalt, this high-powered nuclear sterilization compounds. And what happened was it was very basic on how it worked. They had I called it the Disneyland ride from hell, in that you would put the stuff in, and then it would go in like a Disney ride and go around, and it would go into this room where the walls were like 3 feet thick, 4 feet thick of concrete and lead, and it would go around in the room and come out. And in the middle of the room was a big pool that went down like 30 feet. And they had a crane that would lift the cobalt up. And so when it was sitting way down in the bottom of this water, it would be protected. But then it would pull it up, and then all this gamma radiation would sterilize things like this. And what was crazy is that people are all afraid of nuclear, but right in the middle of this community in Southern California was this sterilization system that was gamma radiating the medicines. I mean, the medical products that kept them alive, and and help people. So that's where we got it, and we got them. We got all this sterilized. So we made it in a clean room. We sterilized it, and so now this was ready for testing. And then we were testing this in the hospitals.
You were actually testing those in the hospitals?
Yeah, they were being used on patients.
I thought you didn't have an actual working
sample.
That is actual working?
And ones like this were used. We would give them, and they would use them on the floor. And we would show the nurses, and they would take samples. And they loved them, because I'll show you why. Now, so as soon as you open it, obviously this was long ago. I wouldn't consider it sterile. It was sterile. But here's the syringe, okay? And it looks almost like a normal syringe. Okay.
Make sure that you don't put your hands in front of what we want to be able to see.
Okay. So, and if you look, can you see the red clip up here on the camera? Okay. So what happens is that unlike a normal syringe, let me tell you. The first ones we did, how precise this is. The thread, the mold manufacturer didn't make this thread correct. So my job, one of the times, was to just twist this on and put it in a package, and then someone would seal it. So we were working through and we were putting it. So I put all these in, but they didn't make the thread right. So when we went and sterilized this thing, and it went through the Disneyland ride from hell, all the needles fell off. And Matt yelled at me and said, "You didn't put on the needles." And I've gone, "Matt, this is ridiculous." So we couldn't use them as tests, so he took it apart, and then he found out the mold makers did not, they were like a half a thou off on the thread, or 2 thous off on the thread, and it wouldn't hold it. But now they finally got it right, and this has been on for 25 years.
Does it have a needle inside?
Oh, yes.
Okay.
All right. So you go like this, and you pull it up, and you put it into your fluid, and you draw it back, and you look like this, and you do normal like, and then I'm sure this brings back most people fond memories of when you were children and getting shots and that sort of thing. Okay, so what would happen, and this isn't quite the final version, so it sticks a little bit, and it's also very old. There's a little seal here, and there's a little plastic carrier, and so what would happen is you would give the shot, and then it would snap. Then...
So the plunger can't come back out now.
Oh yeah, it can, because if you accidentally mismatched it, you can still use it over and over again until you're finally done.
Okay.
So it's reusable. Just because you accidentally snap it, it doesn't mean it. But then when you finally snap it for the final time, what you did was you push this little red clip. Then you would come, and this is so old, and this was one of the last adjustments. I got to push it. And you would pull it back in, okay?
Oh my gosh, look at that.
You would pull it back in the needle, okay? This is why everybody went crazy for this thing once we started it working. Now, I'm about to show you something that the plastic manufacturers, this plastic was coming from a plastic manufacturer, Canadian firm called Hymont. And they came and looked at our product. And they saw this, and so they were going, oh, okay. But Carlos, the brilliant man he was, figured out how to make it break like a glass vial. Okay?
Okay.
All right?
Wow.
Now, when the Hymont executives saw this, and they had an engineering team that would help people develop products, they said, if you came to us and asked us to help you design it so that it's polypropylene, which doesn't break, it bends, and design it so that you could stress it to snap like a glass vial, we would have told you it was impossible. But obviously you figured it out on your own, and you did it. Now the final thing you do is you notice there's a pattern here.
Yeah.
All right? That is designed to avoid the needle, and you push it in, and then the final piece, this is an older version, but when we finally snap it like that, in the finished, well, there goes a little red clip.
The clip back?
Well, that's, now you just throw that in the trash. In our final version, you couldn't get this apart without a hammer. Okay?
Uh-huh.
And so what happened was, there was the needle.
Nice inside, can't come out, can't hurt anybody.
Yeah. And then, once it was designed so that it couldn't be pulled apart,
Uh-huh.
you can use this without having to have those big plastic sharps containers. You could just throw this in a plastic, red bag in the hospitals and throw it away. So once the nurses learned how to use this, which was only a very little thing, and even to this day, and I've looked at all the other ones, none of them come to the simplicity and cost effectiveness of this thing. It started selling itself. And it just, and I still say that unfortunately it's not on the market for reasons we'll talk about in a little while, but it's still, I think, the best, most effective safety syringe.
Now, could anybody look at the demonstration you just did and figure it out?
You'd have to
Are you giving away some kind of secret there?
Well, it was a secret, and we were showing it, and it was being shown to a lot of people. That demonstration I just gave you was given to a lot of people. The engineering that went into that, there were a lot of patents, but those patents were from the early 90s and in mid-90s, and now, 20 years later, all those patents have lapsed. So it's now, in fact, if someone could reverse engineer it and make this daggone thing, if I had the money, I would do this just as a humanitarian. Because when I saw this, and my family is in medicine, and both parents are doctors, a lot of members of my family were in medicine or dentistry or and that sort of thing. And what we learned is that there are thousands of people every year in this country that die from needle sticks. They get hepatitis and they develop hepatic cancer and that sort of thing.
You mean the nurses? And
primary health care givers across the country. And in fact, every time a nurse is stuck, and this was at least back when we were looking at it, it cost the hospital $4,000 to do all the tests and to follow up to make sure that the patient wasn't. And that was in the middle of the AIDS scare too. So you get poked with a needle from an AIDS patient and gets in your blood, you could come out HIV positive. And there's but HIV and AIDS wasn't the biggest killer. It was hepatitis. I think it is B that eventually goes in, and C will eventually kill you from cancer. A lot of them die from cancer 15 years after you contract the disease. So I was looking at it, and my original plan was to become a doctor and that sort of thing, and I kind of veered off, and I kind of laugh and say
in a big way.
In a big way. I veered off in a big way, and so I'm kind of I laugh and I say I'm the black sheep of the family. But when this came along, it balanced. I was hoping it would balance the scales.
On the track of being in medicine.
Yes, and that sort of thing. So, and this cost about $4 million worth of engineering to get it to this point, and then it started selling itself. $4 million to do the engineering.
You guys were able to raise that kind of money?
Yes, we raised very hard. $50,000 and $100,000 and $200,000 and that sort of thing. But as we got closer and closer, and we were giving it to the doc, and then once we got far enough along that things like this could be used in the hospital, the doctors seldom give shots. It's almost always the nurses. And so the nurses were just loving this. And the administrators, once they started seeing what this could mean for their cost control, were beginning to get really excited. So once that happened, it began to sell itself. But the first amounts, the amounts that it took, and this is what took Matt a long time to do, was to bring in small amounts, and we were always on the edge. We were always on the edge trying to figure out how we were going to balance and pay. But we were being very, very smart. We were designing it, and we were always thinking, how can we do this with cheaper and quicker and faster? And so towards the end, we eventually realized that instead of costing $4,000, we could get the cost down to $400 a change if we could get our own facility. So when we got close enough and we got enough money in, we set up a little facility down near San Diego Airport. And it was about 2 blocks away from the airport in this little building. And it was a combination of office, and we then put in some machine shops and got the really high quality machining equipment. But this was still before we had CNC, so we never actually had a CNC lathe, but we had digital mills, and we were handcrafting all of this, and we got a really brilliant machinist in. And Matt picked him up when he was going through all the different shops, and identified this fellow and brought him in. And he could do a turnaround. Instead of taking 2 weeks and $4,000, he could get it turned around in 3, 4, 5 days, and at far less cost. And so we got that in. We were creating our own clean room so we could run it through and that sort of thing. And so we perfected the product once we've really got our own test facility and that sort of thing. So that's where we were. And then once we got it, and this, like I said, this is a little later, older version of it, and the final version really was quite an amazing. Then the next step was, now you have to make 3 to 6 billion of these a year. Okay. Yeah.
Can't do that at a kitchen table.
Well, it took us 12 hours to put 5,000 of these together.
Oh, gosh.
So you'd have to have a lot of people, and that's why we have the syringes and all. You have to have a huge amount of capitalization. And in fact, Matt did talk to the different medical companies about this, and they all looked at it, but they already were all the ones like BD and Sherwood to make those billions and billions of syringes, and that's just for the United States. There's probably 15 to 20 billion of these made a year for the world. You have to have billions of dollars of capitalization. And so when you walk in, you say, oh, this is fantastic. But you're talking, something like this requires a huge capitalization change. We're talking into the billions of dollars. So, and finally their version, BD and Sherwood's, was to put a sheath over this. And so they take their standard syringe, they adjusted the barrel a little bit, and then when you're done, you would slide a sheath over it. And it was, but the nurses hated it because it didn't feel like a normal syringe, and that sheath was always in the way, and it was hard to read through the plastic, and that sort of thing.
It was just a clear plastic sheath.
Yeah, and it would snap in, but it could still come down, and all the rest of it. So they weren't, and that was their solution because it meant that they wouldn't have to change billions of dollars. So the next step was to build the capitalization. And that's where things kind of went wrong.
Okay.
But that's that was the first stages in it. So do you have a question or anything?
No, you're telling the story just fine, and so things started going wrong.
Yes. Okay.
Because it's not in the market.
No.
And unfortunately, you're not a millionaire, so
Yeah.
You never got your projects going as you anticipated. So,
yeah.
So what went wrong?
All right. What went wrong is that we had to fight. We couldn't do business as usual. We were having little money come in, relatively speaking, in order to do the engineering. And so we had to be very precise. We had to do it all in-house. We had to think smart and fast. But then we got to this point, and it started selling itself. And we went from $4 to $10 to $12 million pretty quick. And we were starting to get more money in.
And you're putting those all together by hand?
No,
Oh.
we were only doing small runs to get tests in hospitals.
Okay.
All right. Now, and we were keeping the various hospital, test programs going, so we were generating small volumes and hand assembling it. So the next step was that we had to create a facility to mass produce these things. It took us 5 minutes to assemble it. We have to do 300 a minute.
Oh.
Okay.
Yeah.
So we started looking into making the machines. And the one thing I will say about Mr. Mazer is that he had the ability to find very talented people. Sometimes what he did was not wise, and I'll explain in a little bit what kind of went wrong, but he could find really great people. So we were in a position now with a product, and this product is not like a normal safety syringe. It's got basically, you've got this little red clip, you've got the carrier, you've got a rubber washer there, you've got another rubber washer, two seals, well actually one other seal there, you have the needle carrier and the needle. And so there's, I think, 6 pieces or 5 or 6 pieces, delicate pieces that have to go together. And it's not like your standard safety syringe. It requires a lot more precision to do it. So Matt found, and for the life of me, I cannot remember the fellow's name, but he was basically semi-retired, had moved to San Diego, and was in San Diego, and he was a automations expert, automations engineer. Make the equipment that would assemble various things. And he'd been in the business for 30 years. So Matt found this fellow. And then he found another young man who just recently graduated from UCSD, pretty smart young man, with a lot of book smarts, but not a lot of experience. And then there was myself, and I knew by that point a lot of different technologies, and I had ideas on, and I had been putting this system together, assembling thousands of these on the kitchen table, so I had some idea of it, and I also had been following along very closely to what Carlos Manjares was doing in the design process. So I knew the product, and we had a little 3-man team, and we were in a nice little facility down San Diego. It was probably about 5,000 square feet, enough room to do the engineering. We had our machine shop, so when we designed our pieces for an automation machine, we could have them built right there. We had everything in the place. But what was happening is that this was representing a company that could make billions of syringes. Matt was selling the dream. And this little teeny facility did not portray that image. And so Matt was getting enough money. He changed 2 things. The first was, he says, oh, we don't need to do it in-house. And I said, Matt. And this is where Matt and I had a falling out. I said, Matt, don't do this. Because he found a automations company in New Jersey, I think it was. And in fact, the fellow that we had sitting in our facility that had 30 years experience, he had worked at this company. And he told Matt, first, this has to be what is called a continuous flow machine. You can't make what is called a stepping machine. And I won't explain those things right now, but except for that it continuously flows. Instead of move, do adjustment, move, it's a continuous flow, and it's a dance. It's a beautiful dance of machine and parts and all that. And you have to do it in a continuous flow. And he said, looking at this product, you have to make 3 or 4 different machines that then work together to make the final product. And he said to Matt, and don't go to this company. I work there. You will not get what you need in this first round from them. And I said, Matt, keep it in-house. We got this product that caused Hymont to drop their jaw when we turned plastic into glass, behave like glass. We can do this. And we've got the engineer that designed the product. But Matt said, no. I've got enough money. I can put it out into the company. I can get another independent company to make this product. And I said, no, Matt, you're going to ruin this. And at that point, he couldn't take my demands, and he basically said, okay, no. And he had a friend that needed some help on computers, so I moved over there. Then I did the work for him, and then I came back, and Matt said, oh, okay, I'll give you a job. After I'd been working for basically 2.5 years for free, living off.
You weren't getting a salary all that time?
No, I was living off of part of that, the money that I had left over from. I gave a good 6M.
Oh, okay.
I was not making any money.
That's how you were using the money. You weren't actually giving him your money.
No, I gave him quite a bit to pay for molds, but I kept enough back to cover for a couple of years.
Okay.
Then I came in, and he had the audacity to have me interview. He had a president. He was now building an organization. A massive organization and all the rest of it. He was getting injection molding machines and packaging machines and boxing machines, and he had this 35,000 square foot facility and testing labs and quality control labs and the whole bloody thing.
Whoa.
He spent millions and millions and millions of dollars on this. And
so he sent you for an interview.
By this point the company had a president. He was working as a CEO in the background. So I went into the president and he says, so why are you qualified? Because the guy hadn't even heard about me. So I just started going down the list of all the things I had done and knew about this syringe. I talked to him for 30 minutes. And I said, oh, okay. And he says,
Did you say 30 minutes?
30 minutes.
Okay.
Talking with this fellow of all the things and everything I'd done, the testing and this. So I knew about the needles. I knew much more than I'm saying now, but I was rattling off very quickly. And he goes, at the end, he goes, oh, okay. We'll be in contact. I said, fine. So I went home. I was by this point, I had moved to another apartment. And next morning, at 7 o'clock in the morning, I had slept in, and he caught me in a wake. He caught me. Matt Mazer. And he caught me at just the perfect time. And I picked up the phone, and he started yelling at me for all of the things I had ever done for him, helping to get this thing off.
Why was he yelling?
Because I made him look like a fool in front of his new president. And all I did, one of my rare moments dealing with, I was starting to recognize what this man was all about. I didn't say anything. I just started laughing. It was so amazing that here was this man behaving this way after all of this, and the only thing I could do is just laugh at him, at his fools, at his folly of what he was doing. So I just started laughing and laughing and laughing, and he hung up. And I never heard from him again. Well, actually I did hear from him, But he would not talk to me for at least 2 years. And that brings me to what happened was in this phase over of when we got the team together to build the automation machine. Bill Martin, who was very successful at what he was doing in insurance and estate planning I had talked about before, I introduced him to the idea.
To the syringe.
To the syringe. I showed him this. And he had a lot of doctors that were his clients and that sort of thing. And I introduced him to Bill Martin to Matt Mazer. And those two, on a personality character structure, were much more copacetic than I was ever with either Matt or with Bill. So they hit it off. And then Bill started to get involved with the project. And then at that point, it went kaplunk for me. But by this point, Bill was deep into the project. And so Bill needed my knowledge base to do what he was doing for U.S. Medical. So my process.
So you became his advisor?
Yes, I went from being someone that Matt was going to pay me minuscule amounts of money and put me off in a little corner to now being an advisor to what turned out to be Matt's one of his primary revenue sources.
Wow.
As a consultant. And I'll talk more about that in the next video and what that led to.
Okay, so that story then basically ends there, but it doesn't end there.
No, it does not.
Okay, so let's hear the rest of the story.
Okay. So, what happened was, because I was still in contact with it, Matt went to this company and he ordered a machine, continuous flow machine, and they gave him a bid. And by the way, you need to know a little bit of the history. This company was making all the equipment for BD and Sherwood.
Which company are we talking about?
The automation machine company that Matt went to. It's the premier, glorious automation.
Is this the one that the engineer came from?
Yes.
Well, the one that you should never go to because they won't give you what you want.
Right. Because they make hundreds of millions of dollars a year off of both BD and Sherwood. He said, you will be a small fish and you're threatening both of those companies. So you're asking the premier assembly automation company to build a machine that would eventually put a couple of their primary customers out of business. Disregard the fact that you may become their big customer at some date. So he says, there's a conflict of interest. Mm-hmm. Okay, you go there. So he went, and they gave him a bid for engineering, design, and development of the first machine. So it had to be a continuous flow machine. And continuous flow machines are absolutely amazing things. They take the parts and through a flow of motion, they dance the parts together. And you can see these machines in operation. There are YouTube videos that show them, and they're absolutely magnificent. And that's the only way that you can actually do this and meet the numbers that were needed. Now, the other kind of machine, assembly machine, is called a step place. So you step, the machine rotates, stops, does something, rotates, stops. And so there can be 15 or 20 stations on it, and each one does its little thing. The problem is that version can be much more complicated. It has much more precise timing and that sort of thing, and it cannot go nearly as fast as a continuous flow. So Matt, he put his $600,000 down on the line and said, I need a continuous flow. They said, oh, we'll get this to you in 9 months. 9 months comes, 9 months goes, no machine. It was 6 months late. Cost him $1.2 or $1.3 million. And instead of getting a continuous flow machine, he got a step machine. And the thing never, ever worked right. And so my gut feel, listening to a man who had been in the business for 30 years, and my insights into being around machines and technology and engineering told me, and also the conflict of interest. Mm-hmm. And the company could say, well, no, it was a much more complicated problem, and they had plenty of justifiable reasons for delivering a failed machine. Well, we tried, you got your $1.2 million out of it and delivered nothing to us. And lo and behold, Matt had this 30,000 square foot facility. He had, 16 beautiful Auberg. They were injection molding machines. He had all the molds. He had this system of taking parts right from the mold, injection molding machines, and through air conduction, sweep them up and drop them, and would drop them right to where the assembly machine was. And then they had packaging machines and boxing machines, and the whole plant could have turned out who knows how many millions and tens or hundreds of millions of syringes a year. But sitting right smack dab in the middle of the machine, in the whole flow, was no machine. The critical piece wasn't there. And at that point, he was so deep into all the rest of this, and he was leasing space, and he had all the equipment. He had one shot at this game. One shot at the game. And I knew when he started down this path, he could have had multiple shots if he stayed in that little facility. And if he had built a small, multiple stages, and they didn't work, like the syringe didn't work the first time. If we had just stayed at research and development until we had the most critical piece of the thing, and we had worked it out, so we could just walk into an assembly machine company and say, here's the designs, we've got the working model here, we want you to now produce 10 of these machines. And if you can't make it work, we're going to put you on contingency because we have our machine working. And it might have taken another year or 2 years to do. But at that point, the company would have become, right off the bat, worth $500 million and gone up from there. And by that point, Carlos was already engineering new generation of phlebotomy devices, and he was already looking at the next generation of medical products that we were going to produce. But Matt pitched and rolled the dice and thought he could get snake eyes. And I said, Matt, it doesn't work that way. And he then burnt through 40 mil by the time I walked away. And I'll tell you the rest of the story of what happened there. And then later, he just kept dragging in more and more people. And in 2016?
I think, well, it might have happened in 2016, or 17.
He ended up being brought into federal court, and now he's spending 35 years. He'd been sentenced to 35 years in jail for fraud. And the fraud, it didn't start out as a fraud. This works. Mm-hmm. This should have been in the marketplace. But he got too much money too quickly. And when I learned, watching firsthand, sometimes the worst thing that can happen to a company is to get too much money too quickly. And then you start playing. games that you should not play until you're a profitable business. You stay lean and mean, and you do everything that you can to cheat, not cheat, but, figure out what's the quickest and easiest and lowest cost way, using your brains to overcome it, until you are profitable. And then you can start loosening up a little bit. But he never got profitable with what I still consider one of the most brilliant pieces of plastic engineering. And now the brilliant engineer that designed this thing is also sitting in jail with Matt because they turned it into a racket.
Oh, really?
Because
what did they do?
They kept taking in money. And they kept selling the story, the dream.
They kept selling the old story that they used to get their $40 million, and then...
Yes. They brought in, I heard, $20 million more. They brought in $60 million. We designed this with $4 million. Another $1.5 million internally spent with the engineers. And instead of Matt being in jail right now for fraud, he could have been worth hundreds, if not billions of dollars. That's when I realized there are decisions that you make in your life. There are critical decisions. There's the easy path, and then there's a hard path, kind of like what the Bible says. And you have got to continue to make the hard path. You may not, there is no guarantee that you'll make it even on the hard path. But you take the easy path. The probability is you're going to end up in such a much worse situation than you could if you even failed on the hard path. You will still have learned things, and you will still be able to pull yourself out. But Matt got into it, and he spent his entire life on this. And it was a noble goal to start with. And he got there. And then he made the easy decisions instead of the hard. And then it was all for naught. So.
Why do you think he made those decisions? I mean, did it boil down to motivations on his part?
Yeah. It's fun to have a 30,000 square foot facility and showing off and the potentials for money. And then he bought a house in La Jolla up on the hill behind La Jolla down off the coast. And he had his beautiful house in La Jolla, and he had, the cars and the show, and he was talking to everybody, and he was as they say, the girl that goes to the ball, the belle of the ball, and you had this wonderful story, and you get swept away. And so you put the hard things aside, and you start doing the easy things, and then the money starts coming in, and the money is sweet and easy, and it's glorious, to have a nice home and nice cars and talking to people all over the world about what can become and all the rest of it. That is appealing. I looked at this, and in fact, what's interesting is that normally, the normal syringe, I'll come back to this story a little bit. The normal syringe cost about 3 cents to make, 4 cents. And the BD and Sherwood sell them for 6 cents. They don't make any money on it, packaging and that sort of thing. And it's what is called a loss leader. But once a hospital starts buying from BD, then they need to buy all the IV kits and all the other products. Uh-huh. And so they lose money on this, But once the hospital is buying this, they buy everything else from the same company.
When you're pointing to that and saying this, are you
I'm talking about syringes
just a
in
regular
general.
syringe,
not this guy.
Syringe.
All right. So what happened was that we were going to change that whole game. We were going to make this. This would have cost 6 cents, and we were easily going to be able to sell it for 50 cents.
Mm-hmm.
It was going to be really profitable. We didn't have to have a loss leader on this. But I learned the concept of what a loss leader is. I know it generally had some idea about it, but I really learned on a particular basis on this. U.S. Medical, for me, was the loss leader. I knew I could not start Professor Galambos' theory from U.S. Medical. And Professor used to say, it's better if you're dealing with people that don't understand the theory, make what he called the flatland company. Don't try to make a company based on my theory with people who do not understand what the theory is about. So what I was looking at was U.S. Medical was my loss leader. A multi-billion-dollar. I was trying to help Matt, and I was going to give Matt, I wanted him to have the lion's share. He was doing a lot of the heavy lifting, getting all the money and all that sort of thing. I wanted to make sure that it came because I would make enough money from this project. I had enough investment in the stock, and my parents had put some money in this company. So we had enough that if it had gone to $1 billion company, I would have had more than enough to then go out. And I was already I began to realize machining and manufacturing. I'll talk more about that next video. Could be an ideal place for me. The next phase of automation combined with the theory would change everything. So U.S. Medical, to me, was not a path to making lots and lots of money, and having the fancy cars and the big houses and all the rest. It was the path it was a loss leader, $1 billion loss leader to me, to get enough money to get to the goal of building a stabilized, durable production. But I learned if the people you're working with take a bite out of that apple and don't have the long-term motivations of making the world a better place, the goal is, and I still believe it, I still mean it. If I have to live in a little trailer, and I'll talk more about how I lived in the little trailer later.
You've done it.
I've done it, and I would do it if it meant that I could see to the success to the next generation and the human race has a chance to get to the next level. That was my goal. I suspected that if I succeeded, I wouldn't have to live in a trailer, and I would have things available to me that would still be considered outlandish by even our modern technology standards because of what the theory will produce. But my motivation wasn't that money. It wasn't that glory. This whole damn thing was just one glorious loss leader. For Matt, and then later Carlos, who bit into that apple too, the poisoned apple. They couldn't give it up. They couldn't go back when the first time it collapsed. If they had all sold everything and moved into trailers and started over again and told people honestly what they did wrong and how they could make a path, they could have won the story and won the path. But they didn't want to give up their fancy homes and all the stories and all the glory. And more importantly, to admit, I was wrong. This is where I screwed up big time, and now I'm having to start over. And going back to the investors that you had and say, this is what I goofed. I'm planning to get it going. The other problem is that time was on Matt was on a clock because the patents were only good for 16 years, and he was halfway through that time clock when this thing collapsed.
All right. Well, thank you very much. Good place to end this one. All right.
Thank you.
Till next time.